Just what is at stake for San Diego if all or sections of the new federal health care law are struck down? Joining me are Kamal Muilenburg with San Diegans for Healthcare Coverage and Gregory Knoll, Executive Director of the Consumer Center for Health Education and Advocacy, an independent program of the Legal Aid Society of San Diego. Thank you both for being here.
Thank you.
Thank you.
Gregory, let's start with you. In a nutshell, what are the opponents arguing right now before the U.S. Supreme Court?
Today starts 3 days, total of 6 hours of arguments on 4 major topics. Is it too early to challenge health care law because the penalties don't go into effect until 2014? Is the individual mandate itself constitutional? And if it is not constitutional, can the rest of the law survive without it? And then lastly, 26 states have filed suit regarding the expansion of Medicaid that would, if they refuse to play ball on the expansion of Medicaid, they would lose all Medicaid dollars, and they say that that sanction is not within Congress's power.
Now, Kamal, we hear a lot of people who oppose this. I think the campaign against this healthcare law has been fairly vocal. Mm-hmm. Do we know, though, in terms of California, what the polls say with support?
Well, California is generally tracking along with the rest of the country for if you just ask them what they think about the ACA. But when you drill down into what the ACA is really about, you find that the support goes way, way high. And that's been consistent across the country, too. I think people don't understand this law. They've been listening to a lot of sound bites, and it's very political.
So let's talk about that. Let's drill down a little bit in terms of this law. Tell us so far what has been implemented in California, how that would affect people in San Diego right now.
You know, I wish I had the local numbers. I don't. But for instance, you can cover your child up to age 26 on your plan, and over 2.5 million children have been covered that way. So that expanded age limit was a huge benefit. We no longer can exclude children from coverage because of pre-existing conditions, so those kids who really need the care are able to get it now. And they cannot be refused by a health plan, whether it's in the individual market or the group market.
You have a personal experience, too, in terms of how this law has affected your family.
Yes, my daughter had a lot of medical concerns, and she was uninsured for 2.5 years after she aged out of my coverage plan. And then when they reinstated that children could be on, it wasn't reinstated, put in the new law that children could be on until the age of 26, I was able to put her on, which saved me thousands of dollars. I was taking care of her out of pocket, and it cost over $10,000 while she was uninsured, just for her one medical situation. Right. And now she's covered. She has her own insurance through a small business, and everything is very good.
And Gregory, in terms of expanding this beyond just the individual now, your work with the Legal Aid Society, do you find that hospitals, doctors, businesses know how to access what's available to them through this law as well?
I think that's one of the biggest problems with the Affordable Care Act is that there is not enough education being done around people about how to access all of the good things about it. It's getting better, and I think a lot of doctors are very supportive. There was a very nice pediatrician wrote a nice article in the paper the other day about what it means for kids, some of the things that Kamal was talking about. I mean, I think when you try to take that away from people now that they have, that's a very difficult thing to do. There's a lot of people that every day are having their lives and the lives of their children changed because of the Affordable Care Act.
I think some people at home might say, we don't hear a lot of those stories.
That's true.
Why is that?
I don't know. I mean, I think, you know, maybe it's a question of spending money. Maybe it's a question of whoever yells the loudest gets heard. I really don't know. What I do know is that in my work, I have had a number of examples. I had a family whose little girl had a congenital heart defect. After a year, she could not get coverage, and they almost went broke trying to take care of everything this child needed. the tears in their eyes when they found out that they were going to be able to have her pre-existing condition outlawed and that they could go ahead and get coverage was just, you can't imagine how people are changed forever with something like that. Same thing with parents who are worried about their kids. I had a single mother of two who was 22 years old. Her mother was desperate to try to cover her. She was working, but her employer didn't provide coverage. Well, Mom provided coverage, and it worked out great.
Well, we're going to continue to follow the story. Gregory Knoll, Kamal Muilenburg, thank you so much for both being here. Follow KPBS for more on this issue on the air tonight, tomorrow, on Wednesday night, beginning at 7 p.m. We will have extended coverage, and also you can go to the web at kpbs.org for more on this issue.